Hi, my name is Anika Majaria and you are watching Dubai Live TV. I am at the American Hospital with Dr. Louis Chaptini, who is a gastroenterologist. We're going to be talking about digestive issues and the doctor's thoughts on food intolerance tests. Hi, Dr. Louis Chaptini. Thank you so much for being here today.
Thank you for the invitation.
Please could you introduce yourself and talk to me a little bit about your specialization?
Sure. I joined the American Hospital around 7 months ago. Prior to that, I was in the United States. I did my training in internal medicine and gastroenterology there. And then I practiced. Overall, I've been there for 16 years. The digestive, this specialty deals with digestive diseases and digestive symptoms. Symptoms as common as heartburn, abdominal pain, cramps, to more complicated stuff like jaundice, which would be involving other organs. So basically, we deal with the organs of the digestive systems.
Could you tell me about some of the digestive disorders that you come across?
Common things, for example, are irritable bowel syndrome, which is this condition that affects people with abdominal pain, cramps, change in bowel habits. We see things like ulcers in the stomach or other parts of the digestive systems. Conditions related to the liver, for example, hepatitis that can cause jaundice. So this is, and a lot of other conditions related to other systems.
What are the causes for some of these abnormalities?
Short answer would be we don't know what causes irritable bowel syndrome, but it's a very, very prevalent condition, and it affects millions of people at all ages. We see it in children, old age, young people, and it's basically, it's nothing dangerous. It's a very common and benign condition, but it causes a lot of symptoms. Some people have sensitive bowels, and that's what causes these symptoms.
For individuals suffering from various digestive issues such as bloating, what would you say about food intolerance tests? Would you recommend them?
To tell you the truth, in my practice, I don't recommend doing them. And the reason for that is that we don't know, once we have those results, we don't know what to do with them. They can be misleading in terms of a lot of false positive tests, meaning that I can tell you that you're allergic or sensitive or intolerant to certain product, and you may not be. So that's what we call false positive. The patients are frustrated because they go do these tests, they follow these diets, and they don't get better, and that becomes a problem. And we don't know for sure, like if you follow the guidelines of treatment of these conditions that I was talking about, no one has been able to show in a scientifically sound study that these help in the management of these patients.
Now, you worked in the US for some time and you've been in Dubai for around 7 months. Would you say digestive issues are a bigger problem here, or would you say that both are the same?
These days, diet is pretty similar here and compared to the Western, fast food everywhere. I don't know if this is causing some of these symptoms. It is at some point, but obesity, for example, is a big cause of digestive symptoms, and we are following the Western hemisphere in terms of the frequency of obesity in this part of the world. So yeah, I'm seeing the same kind of nature.
Are there any supplements that you would recommend to individuals in order to optimize digestion?
First of all, eat healthy. Try to have a balanced diet. Avoid fast food, fatty food. In terms of supplements, probiotics are very good to help in the digestion. These are healthy bacteria that we all have healthy bacteria that help with the digestion. So when we take probiotics, we are trying to help with that. There are a few things in certain situations that may help. For example, in pregnant women who have nausea, ginger may help. This is something that can be found over the counter and can be consumed. Peppermint oil has also been shown to help with patients with spasm, abdominal cramps, upset stomach. So these are the kind of supplements. But in terms of taking supplements on a regular basis, in someone who doesn't have any symptoms, there's really no such thing.
Thank you so much, Doctor. That was a great answer, and thank you so much for your time.
You're very welcome. Thank you.